Yes, we can hear you.
Yes, we can hear you. All right. Welcome, everyone. I'm just going to check with my tech here. Michael, are we ready to go?
You are good. Yes.
All right. Thank you. I am Kathy Fitch from the Institute for Social Research and Data Innovation at the University of Minnesota. We house the Minnesota Population Center and the IPM's data projects. I am going to be your moderator for this lightning session, and I will try not to talk fast, but I see this long list of speakers. So I want to get us started. Quick couple housekeeping, as noted in other sessions, if you have not attended the questions, and here I am looking at my other screen, are in the, please post questions in the Q&A. If you want your name, I believe there's a note for you to, a way to indicate to include your name in the question. We are going to save all Q&A till the end of all of the presentations. So I think without further ado, we're going to get started with our, and I should note one other thing. Thanks everyone for your patience. There's really nice speaker bios for everyone. And to keep things moving, I'm just going to introduce folks and get them started. And I encourage you to check out their bios on the at the bottom of the session page. So thank you all. Welcome. And Diana Lavery, could you please get us started?
Hi, everyone. I'm Diana from the population, from Esri, excuse me. And so happy to be here today. I will be talking about ways to incorporate margins of error into your web maps. We'll get going. First, it's going to be about symbology first and foremost. This can happen in all kinds of maps, web maps and print maps. And then with web maps in particular, there are options for pop-ups and labels as well to communicate margins of error. For symbology, we have the options of using outlines or transparency, also creating donut effects by mapping both the upper and the lower bounds, and polygons behind points. So here's what I mean by outlines. You can use outlines to denote which areas have low reliability. And this works really well when you have a very hard cutoff as to what you're calling low reliability. Here we've outlined a few tracts that met that cutoff. Transparency allows for more of a continuous construct of reliability. And so here, tracts that have high reliability are getting that full bright red, and ones that don't are more transparent, fading into the base map. Here we've got this donut effect that I love, where you're mapping both the upper and the lower bounds right on top of each other using the same numeric scale. And so that way you can really see how wide different estimates ranges are. And then finally, putting it all together with the donut effect, with transparency, and then also polygons behind the points. Here, we have got a really strong green color for median income and a more subtle color for the polygons, in this case, yellow, where we can use brighter yellow to denote higher concern with reliability. Moving on to pop-ups. It's always a good idea when communicating ACS estimates to use words such as estimated and approximately. We can state the full MOE or state the range. Here's what I mean by that. Here we've got a pop-up that comes on when you click on San Juan County, New Mexico. Notice the words estimated and approximately here, and we're presenting the MOE itself as well as the full range if you're using this data for any kind of planning purposes. taking that a little bit further, here we've also got a pop-up for a county in Texas where we're stating the MOE, and at Esri we often talk about reliability in terms of 3 flavors: high, medium, and low. And so we can use colors, just red light, green light colors, to match that in terms of the color of the text, which is what we've done here. Moving on to labels, we can state the reliability, maybe perhaps put a warning symbol in only if it's medium or low reliability, or possibly for people who want to see the full data itself, state the full MOE. So here is what I mean by reliability. And with web maps, labels often come on when you zoom in to really close-up views of tracks. Here in Minneapolis is this example. So they're not going to clutter the map up until you're really zooming into an area of interest. Here is what I mean by warning symbols. You'll notice that there are no green symbols here. So if an area does have that high reliability, don't even show me anything, just for medium and low reliability. And then finally, for people who want to see the whole data, you can set it up to show everything when you zoom in. So I know this was a lightning talk, super quick. We didn't get a chance to get into the how-to very much, but I do have quite a few blogs here and resources if you're interested to go to ezraurl.com/moesinmaps. It's a site that I've set up that'll take you to this slide with all these links here for more information and exactly how to do this in ArcGIS Online. However, these approaches can be used in multiple different tools. Thank you.
Great, thank you, Diana. Very excellent start, keeping us on time. And I think maybe you looked up my home address or something, because it just, where I live, popped right up on your slideshow. No, I'm sure she didn't do that. All right, University of Minnesota. I live near where I work. All right, we next welcome Yukiko Fuyura. I'm sorry. Welcome from the EdWeek Research Center. Oh, we need unmute.
Mute, sorry. Yeah, my name is, now can you hear me?
Yeah, thank you.
Okay, great. My name is Yukiko, and I'm a postdoctoral researcher at the Education Week Research Center. Today, I will talk about our Chance for Success Index. So Chance for Success Index was first developed in 2007, and then the current version was developed in 2008 as part of Quality Count, which is our biggest annual report. CFS grades all 50 states on 30 indicators, 13 indicators in early childhood, school years, and adulthood. The nation's leading state on each indicator earned 100 points, with all other states receiving points based on their distance from the best score. And each state point total across all the indicators are averaged and converted into conventional letter grades. And CFS mainly uses ACS one-year estimates, but also use National Assessment of Education Progress, NAEP, and the 4-year adjusted cohort graduation rate. And unless it's specified, all the data source the coming slides are ACS. Next, I talk about each index. Among 13 indicators, 4 of them deal with social and economic conditions related to early childhood before schooling. Family income is % of dependent children living in above low-income families, which is defined as 200% of the federal poverty level, which depends on the size and composition of family. And parent indication is of dependent children with at least one parent who holds a 2 or 4 year post-secondary degree. And parental employment is percent of children with at least one steadily employed parent, which is defined as at least 35 hours per week and 50 weeks per year. Individuals not in the labor force are excluded. And linguistic integration is percent of children whose parents are fluent speakers of English, which is defined as being a native speaker or speaking the language very well. All parents must be fluent in English for family to be linguistically integrated. The next school year's indicator focuses on formal education from preschool through the college years. Preschool enrollment and kindergarten programs enrollment includes both private and public. And but the preschool enrollment is percent of 3 and 4 years old, and kindergarten enrollment is percent of 5 and 6 year old children attending those programs. To calculate cohort size for these two indicators, we put ACS 2017, 18, and 19. And elementary reading achievement is percent of first graders in public schools at or above the proficient level in reading. And middle school mathematics achievement is percent of 8th graders in public schools at or above the proficient level in mathematics. Both are coming from NAEP. NAEP is administered every 2 years, so these indicators score changes every 2 years as well. And high school graduation rate is percent of public school students graduated on time, and young adult education is percent of young adults currently enrolled in the post-secondary education programs or have already earned a post-secondary credential. Those still enrolled in high school programs are excluded. And among 13 indicators, 3 assess adult outcomes focusing on post-secondary education, income, and employment. So adult educational attainment is percent of adults who have earned a post-secondary degree, including associate, bachelor's, graduate, or professional degree. And annual income is percent of adults whose annual income is at or above the national median. But those not in the labor force are excluded. And steady employment is percent of adults steadily employed as full-time and year-round, and those not in the labor force are excluded. This is the result at the glance as a map. These are the first and last states from the result of CFS 2021. In total score, Massachusetts came the first, and New Mexico was the last. And in early foundations, New Hampshire was the first and New Mexico was the last. In school years, Massachusetts was the first and New Mexico was the last. In other outcomes, Districts of Columbia was the last and was first, and the Mississippi was the last. This slide shows changes over time in 3 categories that have small mini-max gaps, which means all states do relatively well compared to other indicators. Some states showed a significant improvement, while others show little or negative improvement. States in the upper part of each cell showed the largest improvement since 2008, and those in the lower part of each cell showed the smallest or negative improvement over time. North Dakota showed the biggest improvement in parental employment, while Vermont showed the minimum improvement. And in kindergarten enrollment, Connecticut improved the most, while Maine actually showed decrease. And in steady employment, Alaska showed the largest improvement, while Connecticut showed the minimum improvement. And next, these 3 categories show large minimum max gaps, which means that all states struggle compared to other indicators. Yet some states showed significant improvement compared to others. Again, states in the upper part of each cell showed the largest improvement since 2008, and those in the lower part of each cell showed the smallest or negative improvement over time. In preschool enrollment, District of Columbia showed the largest improvement, while Wyoming actually showed the decrease. And in 8th grade mathematics, District of Columbia improved the most, and Concho, on the other hand, showed the largest decrease. And adult educational attainment, District of Columbia showed the largest improvement, but North Dakota showed the minimum improvement. That's all. The full report is available on this link, and if you have any question, you can contact me. Thank you.
Thank you. Everyone is doing a great job on time. Thank you. I want to just a quick reminder that you can submit questions, and the first question I can see, and I'm going to make it so I think others can see it soon. They remember to put in the author, so that would be helpful. Oh, see, we're right on time. So questions in the Q&A, I will be moderating those so we can take them all at the end. And now I will introduce our next speaker and welcome you to talk to us about extended school closures.
Hi, good afternoon, everyone. We are from Stanford School of Public Policy, Duke University. Today, I'm going to talk about school closure and distance learning during COVID-19 pandemics. So the pandemic of COVID-19 has been a national public health concern since March 13, 2020. When the White House declared a national emergency. As the coronavirus spread rapidly, state governors issued executive orders or made recommendations for all public schools to be closed. Around the end of April 2020, the governors in 48 states ordered or recommended that schools to be closed for the remainder of the academic year. Well, let's see. School closure is necessary. It can slow the spread of infectious disease during pandemic. But extended school closure is expensive. It carries higher social and economic costs. Extended school closure brings education costs, for example, disrupt education, poor nutrition for students qualified for free and reduced meals, childcare issues due to young students at home or those live in single-parent families. So given the importance of the school closure, but the growing concerns that this closing is expensive for school-age children and their families, it is important to estimate the challenges for students and their families as a first step to support the school closure and the reopen decision in a more informal way. This is a cross-sectional design. The population is students enrolled from pre-K to grade 12 in a public school in the United States. The data comes from 2014-2018 American Community Survey. So this is a descriptive estimate of the whole population. 51%, 3 million school-aged children are enrolled in public schools in the United States. Less than half of them are in elementary schools. Less than half of them are non-Hispanic whites. 50 of them are non-Hispanic Blacks. Over 1/4 of the students live in households receiving SNAP. Let's look at a child care related issue. 52% are age 11 or younger, indicating that 26.7 million students cannot stay alone at home. Over 1/3 of the students living with a single family household. This percent represented 18.6 million students. Parents of 10 million students work either as healthcare workers or in first responder team. Then now let's look at the distance education related measures. 4.5 million children live in households without internet access. 6.5 million students live in households which do not subscribe to an internet services. 5 million students do not have any computer device at home. A computer device refers to laptop, desktop, tablet, and other computer devices. So a total of 8.6 million students are unable to participate in remote education because they have no access to the internet services or do not have any computer device at home. So those measures varies across the state. This graph shows that the prevalence of students living in households without internet access. We can see 3 states with the percent greater than 20. That's Washington, D.C., Mississippi, and New Mexico. This graph shows the percent of the students living in a household without minimum technology to support remote education. So we can see 10 states with the percentage greater than 20, another 15 states with the percent below 15 or 20. And in terms of students living in a household below 185% federal poverty level, the percent is greater than 45% in 9 states. This bar graph compared the portions of students who would be unable to participate in remote education between the low income and the middle income students. So in total, this 30% low income students are unable to participate in remote education, compared with that percent 7.6 for the middle income students. So here's our summary. 8.6 million students are unable to participate in remote education. Pandemic makes it worse for income-based disparity in education. 20.7 million students cannot stay alone at home. Those measures varies across states. Here's our conclusions. The United States at that time is not prepared for a long time school closure. And we are not ready for distance learning yet. We are not ready to solve childcare issues for families with working parents. So here's some policy suggestions. Government should provide students and families with computers and internet services. Each state or maybe each school district should make their own decisions on how to do education. Government should develop policies to address the needs of childcare for families with working parents. And finally, students are unable to threat for hunger and malnutrition when schools are closed. So the government should work with schools to fix this issue. That's all. Thank you so much.
Thank you very much. And keeping us on schedule. Was easy to think back to April at my house with the first grader, well, I guess last year with the kindergartner at home, and think about those numbers. Next up is John Samuels getting his presentation ready to go. So I will restart the timer starting now. Welcome John Samuels from the Bureau of Labor Statistics.
Oh, thank you. So I'm excited to share the research that I've been doing with my colleagues across BEA and BLS to use the American Community Survey to construct industry level measures of labor composition. So this is a concept that is not familiar to most. So I'm just going to give you a brief introduction of what this means. And so the way to think about labor composition is it captures worker heterogeneity. And so it's an adjustment to labor hours worked in productivity measurement that accounts for the skill composition of the workforce. So we can look at a particular industry like hospitals, and there are all sorts of workers within the hospital, from doctors to nurses and receptionists, in addition to cleaning staff. And so what labor composition is seeking to measure is the shift in the distribution of skills over time within an industry. And so one sort of reduced way of thinking about this is we could consider two doctors, both with a medical degree, obviously, but one has been practicing for 25 years and another has been practicing for 2 years. And so in our framework here, these are not the same type of worker because one has much more experience than the other. So BEA and BLS have some new work in progress to use the American Community Survey to track workers cross-classified by industry. We tabulate 63 industries. We tabulate workers by male and female workers. We tabulate workers by class of worker. What that means in this context is workers that are employees of the establishment that they work for and workers that are self-employed. These are different workers in our model. We also track workers by 7 different age groups. And so if you remember the example that I just gave you about the doctors, these age groups are proxying for levels of experience. And the other category that we track is the level of educational attainment. And so we have 6 categories of level of educational attainment. And what we do using the ACS is we estimate the number of workers and their hours worked per week. So when one is measuring productivity, one needs to measure output and inputs. And the flow of inputs into production is the amount of hours each worker works. This is estimated as the number of workers times their average hours worked per week. We also need to make some assumptions in order to figure out how to weight these different types of workers together. And for that, we need to tabulate each worker's average compensation per hour. So when you add up all these different types of workers, you get about 11,000 different types of workers that we're tracking per year. I do want to note some data issues. And even with the amount of observations that we have in the American Community Survey, we do have sparse cells. We could imagine a worker with a PhD, for example, who's 21 years old and working in the warehousing industry. There are just not that many of these workers. So even the ACS has difficulty identifying the number of workers in this category along with their hours worked per week and their wages. We've also noticed that a bit surprised to us that there are some differences even in major macro trends like the number of the share of male workers in the workforce between the current population annual demographic survey and the macro trends that are in the American Community Survey. So this was something that was a bit of a surprise to us. And we're definitely interested in hearing from anyone in the audience that has some experience with these 2 data sets and may be able to help us understand why there are these major differences in sort of macroeconomic trends. I think even the levels of educational attainment across the workforce are different if you tabulate the macro share of the workers with a BA degree and above in the ACS versus in the CPS. So this is definitely a puzzle for the statistical agencies that are trying to use these data sets to measure productivity. But anyway, to get around the sparse cells, what we're using is a statistical technique called small area estimation. And this basically borrows information from similar cells. And in order to refine these estimates, we're using information from the 5-year sample of the American Community Survey, in addition to sort of independent estimates of the number of workers and hours and compensation per hour that are based on the CPS. The second thing we do is we use the procedure called iterative proportional fitting to basically force the macro totals based on the ACS to hit the control totals in the CPS. And the reason we do this is because the CPS ASEC is a very well-known data set that many researchers use to analyze sort of macro trends. So we want to be consistent with that. Just to give you an idea of the impact of these adjustments, I'm just going to pick out one industry here, and this is the warehousing and storage industry. And I'm going to compare three methods of estimating labor composition where they differ only based on the data set that's used. The dark blue line here is an estimate of the change in labor composition over time using only the American Community Survey. And you can see that this is pretty volatile. And that's a bit surprising because labor composition, if you remember what it was, accounts for trends in the shifts of the demographics of the workforce over time. And while, when there are big economic shocks, it's possible that there are, significant changes in this composition year over year. Large fluctuations mostly reflect data problems, not economic realities. So the bottom line is that the dark blue line appears to be too volatile, given what we know about how workers move over the business cycle. You can see that the RAS technique, which is basically scaling things to match the aggregate trend, but not incorporating industry level information, which is in the hash sort of light blue line, doesn't change things much. But this procedure of RASing the data at the industry level and using this small area technique that I just mentioned on the previous slide, which brings in information on the neighboring cells, is useful and helps with the volatility in the labor composition estimates for this particular industry. But just wrapping up here, we're excited to use the ACS to improve the measures of labor composition used by BEA and BLS to measure industry level productivity. We use small area estimation to address the thin cells. And a second major advantage of this is that it's going to lead to a shared methodology between the BEA and the BLS that we are excited to introduce in the near future. And so I am out of time, but I left my contact information on the slide here in case anyone would like to reach out, in particular about reconciling data between the ACS and the CPS.
Thank you. All right, next up we have Tim Schuck and Raven Faye Chandler. Take a pause here and John can stop sharing his screen. Oh, and the next one's ready to go. And more things that have occurred to us over the last 14 months. So measuring isolation risk for seniors. Thank you. And another reminder, put those questions in Q&A and I will make sure the presenters get an advanced chance to think about your questions while they listen to these other presentations. All right, thank you.
Well, good afternoon, everyone. I'm Tim Schuck. I'm a data analyst at the Pennsylvania State Data Center. You can probably tell from the name of that organization that we're a member of the State Data Center program, which makes us the official liaison to the U.S. Census Bureau. We've been around since 1981, just outside of our capital, Harrisburg, and South Central PA at Penn State Harrisburg's Harrisburg campus, helping Pennsylvanians source and analyze data. I'm joined by my wonderful colleague, Dr. Raven Faye Chandler. Hi, Raven.
Hi. So I am also affiliated to some extent with the PA State Data Center. My position is the director of the Pennsylvania Population Network, which is a new center funded by Penn State main campus at University Park. It was a strategic initiative grant, and some of the folks at the PA State Data Center serve on kind of our board. And Tim and I started talking when very early on in the COVID kind of beginning pandemic stages, and talking about what concerns we might have. As many of you may or may not know, Pennsylvania is an older state. We have a very large elderly population. And so we started wanting to explore what kind of factors may increase vulnerability and risk for the older population amidst the COVID-19 pandemic. So my background is in health specifically, and demographic and social differences in health outcomes. And so we know that social isolation impacts individuals' health outcomes, so that, that can be access to care, but also just being socially isolated can lead to not having access to food or other community activities that increase well-being, particularly mental health among the older populations. We know that older adults were at risk for having more severe complications with COVID, and being more likely to unfortunately pass away from COVID. So we know that these things are all combined, and we want to be paying attention to them. So as mentioned previously, Pennsylvania has a very large concentration of older adults, 2.4 million. And so that's a large population of our state that is at risk for these complications with the pandemic. So we started to look at other aspects. We wanted to see what type of metrics we could use for isolation. So we used the America's Health Rankings for, issues on poverty, marital status, disability factors, whether or not these individuals lived alone. So again, these are all factors used specifically amongst the 65 plus population. So the rate of poverty among those, that population specifically. We also used a number of measures for transportation. Tim will talk a little bit about that later, about some positives and negatives of using that and how that varies across our state. Their individual health, if they've moved recently, their amount of money spent on their rent. And so those also came from the American Community Survey.
Yeah, so we took basically what we found in the research, and we wanted to operationalize it into data that was widely available. So you'll notice most of these 11 indicators that we found come from the ACS, and then 2 come from other national programs. So the CDC's Behavioral Risk Factor Surveillance System, and then also the USDA's Food Access Research Atlas for food security. And these data sets are great because they make data available almost at the county level, with the exception of the CDC's program. And then they're also available across the nation. So counties, we ranked counties based on each indicator, and we gave from 1 to 67 because we have 67 counties. We chose to give favorable scores such as low percentage of older adults in poverty, a score of 1, and then 67 would be a county that had the highest. The ranks were averaged across each indicator category. So we created 4 sub indices that related back to senior finances, living arrangements of older individuals, their ability to access community, and then also individual barriers. And then, And then we averaged across the 4 to create a final index score. We normalized it so that we had values that, from 1 to 100, where 1 represented the lowest risk, and then 100 represented the highest risk. Raven, do you mind
Yes,
letting
perfect.
them know what we find?
So our index scores ranged from 28.5, so on the low end in Forest County, to 87.3 in Philadelphia County. That's pretty unsurprising for us that are familiar with the state, because Forest County has one of the smallest populations as well. So Philly, where the city of Philadelphia is also in the county of Philadelphia, ranks the highest on the 6 indicators of poverty, having a vehicle access, disability, limited English proficiency, and being widowed or divorced, and having poor mental health. Again, the vehicle access is less of a concern in a county like Philadelphia because of the amount of access to public transportation, but for a large proportion of the state, which is very rural, that is a bigger access issue. The second highest is also housing cost burden and living alone. And so, as mentioned, personal vehicle ownership is less of an issue in urban areas, so in Allegheny County as well, where Pittsburgh is, but a lot of the state does not have great public transportation in these rural counties. So having a vehicle access is kind of, it depends on where we're at. So we know that's a limitation. We do not consider any differences across racial groups. Again, with Pennsylvania, less of an issue in some places than it is in more. Many of the rural counties tend to have very large proportions of white individuals and very little racial or ethnic diversity. And then the food insecurity data that we used from the USDA's database is pretty outdated as far as comparing that to the most recent ACS data.
Yeah, and so our final report used Esri. Esri is pretty much the industry leader in mapping and GIS software. If you're at a university like us, Esri makes these tools very available at no or low costs. These tools allowed us to create really interactive narrative so that users could kind of click on maps and get the data behind the maps and each index. In addition to highlighting the main findings, the report has a section dedicated to each category. So an individual can really break into the data that's underlying all of the index categories. And just an additional note, if you're interested in the data we used, if you go to the report, we have it down to specific ACS tables and their table codes. So if you're interested in seeing how counties in your state might fare under this index or framework, we made it very transparent and very easy to do so. And so the link to the final report is in the PowerPoint, which we've shared. So we encourage you to go through, read through it, and if you have any interest in talking more about it, please get in touch with us.
Great, thank you very much. Next up, we have Kevin Werner from the Urban Institute. I'll give him a chance to get started.
All right. Thank you all for coming. I'm happy to be able to present this. So I'm going to be talking about how we use the ACS to estimate the characteristics of earned income tax credit eligible tax filers in different geographic areas. So we use the 2018 ACS as it has been adopted for the Urban Institute's model that we call ADIS. That stands for the Analysis of Transfers, Taxes, and Income Security. This is a micro simulation model that simulates the major tax and transfer programs in the United States. And because it uses the ACS, we are able to look at states and other subnational geographies. And we focus on tax units that are simulated to be eligible for the earned income tax credit. And we also present additional data on the additional child tax credit. These are both refundable tax credits for low-income workers. They have been found to have a very large anti-poverty effect. In fact, they are some of the largest means-tested anti-poverty programs in the country, and they are of interest to advocates and policy makers and researchers. So our goal with this project was to get a picture of what the EITC eligible population looks like in different areas. So we include a lot of demographic characteristics such as race, marital status, education, language spoken at home, occupation, industry, family structure, and a number of other characteristics. And we present data by state, metropolitan area, counties, and then non-metropolitan areas. And we use PUMAs as public use microdata areas as reported on the ACS to assign people to these different geographies. And the reason why the ACS is the best source of data for this project was, of course, the CPS has too small of a sample size to get reliable estimates when we start talking about counties and especially some non-metropolitan areas. And while the IRS does have public use data, it does not have demographic characteristics on that. So the ACS is the best choice. And so this is just a small slice of what our data looks like this shows the state data. So you can see, for instance, the first row, Alabama, we estimate about 2 million tax filing units, and of those, about 370,000 are eligible for the earned income tax credit. And you can see we have marital or filing status, race. In Alabama, about 52% of earned income tax credit eligible filers are white, and about 40% are Black. And on the main, on the actual data, you'd be able to scroll and see quite a few other characteristics. And I want to briefly talk about the non-metropolitan areas. As we mentioned, we use PUMAs to map people to non-metro areas. One of the challenges that we had is that a lot of PUMAs include both metro and non-metro areas. In fact, 60% of PUMAs that have any non-metro area also contain metro areas. So while we want to be able to talk about what the earned income tax credit eligible population in rural areas looks like, we weren't exactly sure how to define this. So we ended up presenting 3 different definitions of non-metro based on the percent of the PUMA that was non-metro. So we talk about exclusively, mostly, and any non-metro. So for each state, we show all 3 of those. And we also include a list of which PUMAs fall under the different definitions so that users can know what areas they are looking at information for. And so just another example, this is what the data looks like for the non-metropolitan areas. You can see the first 3 rows are the 3 different definitions of non-metro in Alabama. And the first column there includes the unweighted sample size, so people can get an idea of the reliability of the estimates. And then we have the weighted estimates, and we include all of the same information as we do for states, metropolitan areas, and counties. So the data is available in spreadsheet format on the Urban Institute Data Catalog. And we would like to thank Center on Budget and Policy Priorities for funding for this work. And thank you for your time.
Hello, I'm clicking too quickly here. All right, we have a final presentation. And I just want to note, in case anyone was waiting, and I apologize that you, I did not mention it earlier, the presentation on 2020 Miami-Dade County Comprehensive Community Needs Assessment that was to be presented by Camilla Mason is not going to be presented today. So if you were waiting for that, my apologies. So this is our last presentation. So while you're listening, I will check for questions in the Q&A and encourage the authors to be thinking about questions for the other presenters. And I will welcome Kenneth Stewart.
Yeah, thank you, Kathy. Listen, it's a privilege to be here today, and thanks to those of you who are attending. My partner and I, Casey Jones, who's listed there on the slide, are recently retired professors from Angelo State University here in San Angelo, Texas, the city you see in the image in the background. And one of the things that we do in the community is write a monthly column in the San Angelo Standard Times, the local newspaper. This column is called Pathways to Progress. A typical article in Pathways to Progress is about 1,500 words long with accompanying graphics, which often use data from the ACS as well as combinations of data with from many of the other sources that have been represented here today. We started this back in 2011 because at that time we were operating, Casey and I were operating a small research center, community-based research center called Community Development Initiatives. And the Community Development Initiatives was in the business of conducting research that would focus on vulnerable populations. Here you see a list of articles that appeared at different times in the newspaper. You can tell from just reading the titles and looking at the summaries that many of them would use data from the American Community Survey. The two that are identified in red are linked to our Pathways for Progress archive, and I've also provided for you a copy of the archive so that you can go to any of the articles in the entire collection and download them for yourself as they may interest you. One of the things we try to do with Pathways to Progress is stimulate change for the better in our community. And so for the rest of the presentation, I want to focus on one of our major success stories in that process. And so I want to talk about how Pathways to Progress was used to contribute to the origins of the San Angelo Diabetes Coalition, which started with a community development initiatives project in which we did a survey of the poor and extremely poor in these 20 counties of West Texas. Those are all rural counties except the one where San Angelo is. San Angelo is kind of a service hub for all of those. And so this is called generally the Concho Valley region. It's about the size of the state of Maryland. And so that gives you an idea of the extent of it. Pay attention to these partners down here. These are essentially the medical partners in the community. And they are the partners that eventually created the Diabetes Association. So I wanted to point that out. what we did in the survey of the poor is we constructed a questionnaire that paralleled, what I mean by paralleled, it turned a series of questions from the Texas BRFSS, Behavioral Risk Factor Surveillance System. It paralleled those in a sort of kitchen table conversational format and asked people this kind of a range of questions about their health status and health issues. We also, in the survey, engaged the community in many ways, as you can see down here at the bottom. Particularly important is the 64 trained community survey facilitators. They're the ones that actually did the surveys or did the interviews with the poor in the project. Uses of the ACS data in this context, I've got a list of key uses here, and I'll be showing you one of them here in a second. But one of our problems was to create a proportional sampling process where we wanted to get samples from our 20 different counties that were in proportion to the representation of the poverty population. We also conducted a gap analysis identifying differences between our survey and what the Texas BRFSS showed on the pre-existing results. We needed to post-stratify the BRFSS indicators so that they were adjusted to the demography of our county. We used the ACS data for that purpose. And we also had our health partners create a series of health and behavioral health needs priorities. And we had to create estimations of populations that would be impacted based on ACS data in that context. This is an example of some of the items from the gap analysis. It's a short representation. What you can see is some really eye-popping differences over here in the gold bars. These are the percentages of people that in our survey indicated that they'd been diagnosed with depression or diabetes and other kinds of factors related to diabetes. And you can see that the estimates from the survey were much higher than the estimates from the BRFSS represented in the blue bars. With that gap analysis in mind, our health needs priority folks then identified these priorities: reducing potentially problematic hospitalizations from diabetes, potentially preventable hospitalizations from diabetes, reducing obesity in the vulnerable groups of the community, promoting healthy limit and improving case management among vulnerable groups of type 2 diabetes. So from that, we worked with the various partners. You see them listed. They came together in 2017 and started a process to create the San Angelo Diabetes Coalition. By 2019, that was funded, getting underway, had 60 people enrolled in a diabetes coalition program to enhance management of diabetes. The community health workers, there are two of them that you see here. These are mother and daughter, Mary and Teresa Montez. The community health workers are the sort of spearheads of the program that was developed. They work with patients that are enrolled in the program to do the things you see listed here. And if you know what an A1C is, that's the average blood sugar of people as measured in a medical test. And you can see that they have created some significant reductions through this program in the average blood sugar of type 2 diabetics in our community, particularly those in vulnerable groups. And this is something that has some important outcomes like this one. Each point in the reduction of A1C, each percentage point in the reduction of A1C is equivalent to reducing eye, kidney, and nerve damage in diabetics by about 40%. So in summary, just to do this quickly, these are the ways that we use pathways to progress to save lives and improve conditions in San Angelo, Texas. Thank you.
Thank you very much, Kenneth. What we're gonna do now is I have posted some of the questions to the Q&A, and I will display them and read them for the authors, and that author can, unmute themselves and turn on the video and come say hello and answer the question. So I think that's how we'll proceed, since there's a little too many of us to, I think, make this work with all of us at once. So I will start back to the first presentation for Diana. A question: how do you calculate high, medium, and low reliability?
Great question, thank you. Yeah, at Esri, we tend to use 12 and 40 as our cutoffs. So anything with the CV less than or equal to 12% would be considered high reliability. And then between 12 and then up to 40, we consider medium. Anything above 40 is low reliability. So that's where some of the green, yellow, and red color assignment comes from. But if your organization uses other cutoffs, you can definitely set those color breaks at any point you like. And some of the symbology techniques actually allowed for a continuous construct of reliability. And I'll put that link again to some of our blogs and information about more of the details for everyone. Thank you.
Thanks, Diana. Any follow-ups on that question from the, it's hard for me to probably take questions, but I'll let the presenters jump in with any follow-ups from each question. All right, next up for Tim and Raven. Oh, wait, nope. Just, I have these in the wrong order. Great, this is for Yukiko. Would the chance for success index be relevant for smaller geographies? Would it be possible to break it down to the county or census tract level and still be meaningful? Unmute. I appreciate being cautious.
Okay,
we can hear you now.
So unfortunately, we do not provide smaller geographies because we are interested in state level, because smaller geography involves more variance and errors, and most policy changes, like including funding as well, happen in state level. But however, technically, it's doable to break down into small county, because what we do is aggregating those relevant variables like income and educational attainment by state level, but by aggregating it by smaller areas like metropolitan areas or county level or the census tract, it's doable to do something similar like that.
Thank you. Any follow-ups on that question?
I would just comment, this is Ken Stewart. I would just comment that, you know, in our work, we tend to accept a little higher degree of error because what we've found is that in small geographies, if you don't have an estimate at all, then what you have is a guess from the barroom.
If there's get back to degrees of uncertainty.
Yeah.
All right. Thank you. Anything else on that? We do have next up a question for Tim and Raven. Do you know if any state or local agencies in Pennsylvania are using your index to target services to elderly residents?
That's a good question. I think a lot of analysts can probably sympathize that you do this work and it goes out and you hope that it's implemented, but you never quite know. I do know that we got feedback from individuals in the organization that was good. Raven, do you know of any particular use cases? Have you seen that?
So I'm not familiar with anybody specifically using our index. However, as Tim said, the information has been provided to the Department of Health. I work specifically with the health equity team. And we also presented to a local state representative who works on mental health in Pennsylvania. So he has a mental health caucus and asked us to present our information there. So it is out there and people have seen it, but I don't think they're using it specifically.
Yeah, exactly. Thank you though.
Thank you. The next question for John. So this is, you mentioned you used 5-year estimates from the ACS. Is that correct for the chart where you mentioned volatility? I was surprised to see volatility in the ACS data from year to year, considering you were using 5-year estimates. And and a little bit cut off. I copied this from the Zoom question. And 80% of the sample would have been the same from one year to the next. What do you think is going on there?
Yeah, so just to put this question in context, and thanks for the question, Tim. The major is these indices of labor composition are a bit more volatile than we would expect, given what we know about how demographics evolve. And so these estimates of labor composition capture the skill and experience mix of workers in a given industry over time. And these things do not change very rapidly over time, although if there is a significant economic shock, something like that does have the potential to impact a labor composition measure somewhat quickly. If an economic bust, it's often workers of a lower level of educational attainment that are forced into layoffs or out of work. And that is a very sharp change in an economic trend that can show up in labor composition fairly quickly. But other than that, we expect most of these measures to be fairly smooth. So Tim was asking me about what's happening in this particular example that I gave, since it does appear to be volatile, and especially given that I mentioned that we're using the 5-year ACS, which is just a huge sample. So this requires a bit of clarification. The first thing is that we're really using the 5-year ACS to inform our single year estimate. So you can think about the model that we're running. On the left-hand side, we have an estimate for period T that's supposed to be contemporaneous and reflecting what's happening in the economy and the industry in period T. And on the right-hand side, we have a bunch of stuff. A bunch of that stuff is the 5-year American Community Survey estimate, and that should be pretty smooth. But we don't want to use the 5-year estimate as the point estimate because, as I said, there are economic changes that we do want to include in our model that do happen year over year and don't happen at the 5-year sort of smooth estimate sense. And so in essence, we're really only using the 1-year ACS estimate supplemented with some information to try to bring in more reliable information, because in the end, the ACS, surprisingly, in a certain sense, does have these somewhat thin cells. It's a huge data set, but once it's cross-classified by all these workers, on average, I think there are about 145 observations per cell, but that's definitely not the average that applies to each cell. There are some very small cells where we have only 1 or 2 observations, like I was saying, for a very highly educated person in a small industry of a very low age group. And so we do have this volatility that results from that, and we're trying to use this small area estimation model to improve upon that. So that's the story there.
All right, that was a question from one of the other presenters. Any follow-up before we move to the next? All right, I will, I've got one more question here for Kevin. Do you make any special adjustments for small population areas like Vermont that will be would have large errors compared to other large areas like New York? Also, do you think using 3-year 5-year estimate instead of 1-year estimate would be more reliable? 3 or 4, 3 or 5, I suspect. This is what we do with the CFS index, and this is from Yukiko.
Yes, that's a good question. No, we don't make any adjustments. The only adjustment that we make is when we're talking about the non-metropolitan areas, we scale the weighted values by the percent of the population in each Puma that is in a non-metro area. But for the states, we don't make any adjustments, based on state size. I think we are confident that the ACS has a large enough sample size, even just in 1 year, that the estimates are pretty reliable. But that is a good point. It's not something that we have done before. Most of our work is with 1 year ACS, but it's definitely something to think about. So thank you for the question.
Great. Any follow-up or any additional questions from the audience? Let me make sure I've got the tab open here in Q&A, checking anything that comes in. Oh, we do have one more. Okay, so thanks everyone for your patience here while I used to questions. This is for Dr. Stewart. Have you seen any analysis of the economic impact of the diabetes project? It seems that would be justification for the cost of collecting ACS data and analysis needed to apply it to this problem.
Haven't seen economic impact per se. And that's a good idea, something I maybe should estimate at some point. Funding for the project so far has not been too much of a problem, especially from the standpoint of data, because there are funding agencies involved that regularly require assessments of the programs and activities, and so there are plenty of already paid for opportunities for data analysis.
Great. I was also wondering if the implication was, you know, all of these questions are the people have been looking at, and questions with policy implications all sort of demonstrate the value of these ACS and how it's deployed in so many different ways, and is quite a valuable resource in and of itself. I was just impressed thinking, you know, through the topics, you know, when faced with a pandemic and a dramatic change in the economy and people's work lives, you know, ACS information was there to help people interpret impact. So
yeah, thank you. You know, and another really major part of all of this kind of activity, and I do wish there was kind of more of it, but you have to speak differently than what we're doing here at this conference. A lot less technical language and a lot more, you know, instead of per capita, it becomes average per person or something like that, you know, more plain English kinds of terms. And so, you know, it's an experience.
that's a good, very good reminder that talking to different audiences, I just want to encourage everyone to maybe turn on their cameras so that I guess we can all thank each other and for the interesting research and doing an exceptionally good job of staying on time. I am very impressed with everyone's paying attention to the short clock. So we'll maybe give everyone a couple extra minutes to prepare for the next session, and we will conclude for the day. So thank you all.
Thank you.
Bye.
Thank you.